Hi, Dr. Choucair. We're continuing a little bit of a series about facelift details. So one of the questions I'll address now is, patients come in and say, I saw so many bad looking facelifts, I'm really concerned about doing anything like that. And the first thing I say is, well, when you go to dinner at a nice place and you look to your right at someone who clearly has had a facelift, because how would you know if they didn't look a little bit abnormal? Well, you don't look to your left and see the lady sitting or gentleman sitting next to you who looks very nice and probably younger than their age, and you don't even notice because they've had good work. So that's the dichotomy. That's the difficulty, is that you only notice what is abnormal. You don't notice a facelift that's done well, and you can't even, determine any anatomic areas that look funny. So that's the first thing, is we don't notice all the good ones. But how do you know if someone's had a good facelift? Well, I've kind of already mentioned, you just don't see any details that look out of place. The hairline is not distorted. The area around the ear is not pulled or abnormal. The incisions, if they have them behind the hair, show that the hairline is still intact. It's not distorted or moved. And hopefully the scars are very thin and narrow, and even with the hair pulled back in women who wear a ponytail, if there is an incision, it's such a faint hairline you can't see it. Well, how does that happen? Well, it's all about planning and details, and that's all a facelift is. Again, I mentioned in previous videos, there's very little blood loss with a facelift, and though it may take 4 and 5 hours to do a good facelift, that doesn't mean it's invasive deep surgery. In fact, the only reason we do a facelift under a light general is just so the patient's comfortable and doesn't have any concerns about feeling or seeing anything during the surgery. And the anesthesiologists like it because they can control the anesthetic very well. In most cases, the patients are breathing on their own. But it just takes time to do the detail work. And the detail work is what determines whether it's a, quote, good or bad facelift. And the term good or bad is such a polar term. There's really a lot in between. But in general, I've already mentioned that good facelifts don't have any demonstrable signs of a facelift. There's no pull to the corner of the mouth that's back this way, because the pull is gently up and the pull in the neck is gently back. And again, there's no distortion. So why would someone have a less than optimal, how about we use a more diplomatic term, less than optimal facelift? Well, it's all about detail. It's usually not a bad surgeon. It's maybe a surgeon who doesn't have the interest or the focus or the expertise to pull off a facelift that is, quote, good or optimum. So the key is that if you see a surgeon and you want to consider a facelift, you really have to just get into the details with him. And so what we're here to do is try and help you with those details. And going over them again, it's no hair shift. The hair of the sideburn and the area behind the ear stays about the same. There's no pull to the ear. We call it a pixie ear, where the ear is pulled down because the skin's pulled so tight that the tension pulls the ear down. There's no distortion of what we call the tragus, which is this little area of the ear here that has such a delicate balance to it. All those details are what requires the time to do the surgery in less, in 4 or 5 hours instead of an hour and a half or 2 hours. And of course there's longevity, but longevity really is a separate issue as far as how long will the facelift last. That really is not part of a good facelift, bad facelift discussion, but obviously patients want it to last as long as possible. So again, there's no secrets, I like to say, in Paris, New York, or Beverly Hills. The surgeons who do a lot of facelifts go to meetings and are board certified, know what the details of a good facelift are or an ideal facelift. It usually means you're not pulling the skin tight, you're doing a deep muscle repair first so that the architecture of the deep neck is as optimum as possible, and you gently lay the skin over it. If you pull the skin exceedingly tight, not only does it maybe not look good, but the scars will spread, and that's counter to having a good facelift. So the tension on the facelift has to be ideal. Surgeons often face the mild wrath of a patient after 6 months saying, I thought you could have pulled it tighter. And I look and say, I could have pulled it tighter, but that's not the point. Then you wouldn't have hairline incisions and you wouldn't look normal. There is a balance there. And that comes in the first consultation with the patient, so they understand the give and take of the facelift. So again, a bad facelift or a less than optimum facelift is really just a lack of detail and focus. It's not that hard. It's not rocket science. It's not proverbial brain surgery at all. It's just focusing on details and having an interest in the artistry of the surgery. You have to love it, or you're just not going to enjoy doing it. And when our results are on display for the public, which is why many surgeons don't necessarily love facelifts, it becomes a little bit difficult if you don't love it. So anyway, I hope that helps you understand maybe a little bit of the good and the bad of the facelift.